Hello, our viewers of Civic Space TV. Yes, a good afternoon to you all. We hope you're doing well. Yeah, and to those that are not well, those who have lost their relatives and you have had many unfortunate things, we really condole with you. For those who have had a good week, we celebrate with you, and those who have not yet made it, we continue to pray for you. This is Women Rise, Women at the Front Lines. My name is Nayiga Madreen. I'm your host. And today with me in studio, I have a professional. She is a professional and one of the frontline workers, yes, in the country. Yeah, during COVID-19, the rest of us had to go into lockdown, but these people were the frontline. They didn't have a lockdown, so they're always in around. So join me as we welcome Dr. Maria Prima. Yes, welcome, Doctor.
Thank you.
How are you?
I'm fine, thank you.
Yeah, it's a rainy season and a lot of malaria. People are coughing, flu.
Yeah, very
What could be?
unfortunate. Even in the hospitals, we are overwhelmed with the flus and the cough, and also when it's school going time. Yeah, you have a lot of this happening because you treat the flu, the child goes to school, picks from someone else, treat it again, happens again. So yeah, that's what is going on. Malaria, it's a rainy season. That's why the habitats of breeding for the mosquitoes increase with that, the stagnant waters and stuff. Yeah.
Okay. Yeah, so Doctor, welcome to Women Rise, Women at the Front Lines. This is a space for women. Yeah, young women, women who have made it. As long as you're a woman, you're doing something in society for people, and people are appreciating. We get to host you on this particular show. So we believe
I'm humbled.
Yeah, because if you're not doing something, and people will not look for you. So we look for people who are doing really something in society. It can be with your family. You're a leader at family level, community level, at school, at your church. So as long as you're a woman and you're really, really taking up these spaces. And one of the reasons for this particular show is to mentor young women, the young girls. Yes, we all have mentors. We have people we look up to. These people have lived their life, and we would also wish to maybe copy from what they have experienced, learn a little more from what they have shared. So that's why we bring you people in society who have done something in society, so that you're able to pick something from them and add on your life, so that you become someone better, even better than what your mentors are in life. So welcome again, and to our new viewers, thank you for joining us. Women Rise is always here at 3 p.m. on Saturdays, and you can also follow us on all our social media handles. We are on Twitter, Facebook, TikTok, Instagram, and of course, YouTube. So let us go deep down into the conversation with Dr. Prima. Yes, Dr. Prima, our viewers would like to know, who is Dr. Prima? I didn't also mention the other name. I didn't want to make mistakes.
Okay.
Yes, so who is Dr. Prima?
I'm Prima Niwampeire, and usually when I'm not in the workspace, I prefer just to be called Prima.
Okay.
Yeah, but you find yourself, you're somewhere, social event, and someone screaming, "Oh, Dr. Prima!" You don't tell people. Yeah, so Prima Niwampeire, I'm a medical doctor currently working around Kampala and Wakiso in various hospitals, and that's what I do professionally. I'm also very passionate about community health and community service, and reaching out to communities. So I am under different projects running, either under Rotaract or under the church. Health education, yes, that's what I do professionally. On the other side, I am passionate about manufacturing, and in this sense, I went into textiles.
Okay.
So I have a team of 4 other people back in lockdown, we started up a venture where we make items from yarn, what we call threads. Sweaters, you know, skirts, tops, beanies, and all those things. And we started it up just like a passion, a group of, by then we were medical students who had passion about that. So we just started it up that time as something very small, but it started growing. Currently, we also make graduation sashes. For those people who are graduating, customized with your name and, you know, a concept we got from the universities abroad. Yeah, so we are growing and day by day. And also trying to marry both things, that professional career and then this passion or skill-based career.
So it is possible to do your profession and also venture into something else.
It's very possible, and it's even possible to marry them, because later on when I went to ward I was working in Mulago. I noticed there were so many women who had like chronically ill children, and now they would reach a point and, you know, they tell you, oh, I cannot afford the services anymore, I can't afford to be in hospital. Mulago is free, but then there are other things you have to buy, also food and all other things when in the hospital. So they tell you, oh, I want to leave the hospital. Now you're looking for how you can help them. At times we used to collect money as colleagues. Let's collect money and buy this drug for this patient. But that's not a sustainable plan. So I thought about a skilling program for these mothers to teach them the handwork that I used to do, so that they're able to generate income from that. So yes, that's how I have tried to marry the two. The skilling program is at inception level. So yeah, we shall be updating you as we go forward.
We shall look out for that.
Yes, so that's who I am briefly. That's it. Yeah.
Okay. And so you tell our viewers, when growing up, where do you get this inspiration from to become a doctor? Who inspires you? Where do you go to school in your childhood? Yes.
Okay. My inspiration was from three sources. One, I was very passionate about science. Okay. I think I've started from too far. I think that came in now when I'd started school. Where do I come from before I know science? Before I know science, the people around me, my guardian, my father is a medical doctor. So growing up and from a remote setting, I didn't get to see what other professionals do. If you sat me down and asked me what do accountants do, I had no idea. I only knew what doctors do. Yes, I only knew what doctors do. I didn't know what other people do. So it's like going to school. It was already predetermined in my mind that oh, this is what I want to be, because wow. Yes. So that happens, but then also my grandfather, who was also my guardian at one point in life, was very passionate about he loved doctors in general. I didn't hear him talk about anything else. And me, him being a person I looked up to, one of the people I looked up to, and it inspired me, it drove me. So now I go to school and I find science so interesting. I find that it's explaining why this and this is happening. I was very passionate about it.
You find science at school, science at home.
So it was
easier.
It was interesting. The third thing is I looked for ways that I could reach out to society, serve society. Maybe this came in earlier, understanding that you can use any profession to reach out to society, really. But then I thought, oh, it's doctors who reach out to society the more. Okay, healthcare professionals. Because this is the thing, my guardian, whenever he would treat patients, he used to be so busy, very busy. You know, even up to now, the ratio, the doctor-patient ratio is still unfavorable. We are way below the recommended values. So now by then, and in a remote setting, it was even worse. So he would treat patients, and then he would even like never get to see them appreciating, because he wouldn't be home. He has gone to treat others, but then they come in looking for him. Oh, where is doctor? And they brought appreciation gifts. That time it used to be chicken and matoke.
Yeah, so I see you also looked at that.
No, not really, but yeah, to me, I was like, this is the person who is touching communities the most. Yeah, so.
And you were not scared about the injection part?
No, I wasn't. I don't even know why, because you find people, even as we reach medical school, even by the time we start medical school, we go to the cadaver rooms. That's where the dead bodies. In the early years, we do our learning from dead bodies. So we go to the cadaver room, and people freak out. Like, it's so scary. I wasn't. As like, yo, here we come. It was exciting for me. So no, I wasn't really scared. Yes. So where I go to school, my journey of education, I didn't go to kindergarten.
Okay.
I started from primary one. What I would call kindergarten was what people nowadays call homeschooling. And my grandfather was literate. He had studied, I don't know the levels, but he said up to junior 8. Now I can't relate it to the levels now, but that should have been like senior 2 of then. Yeah. So he insists on teaching me from home. He said I was too young to be woken up every morning to go to school. And he said he was bright enough. He was as bright as my kindergarten teachers.
He decided to do it himself.
And it was, well, I later on, when I went to primary one, I found out that he had actually taught me very hard things. He had taught me very hard things. But then also it helped me, because now when I go to primary one, eventually, when I'm 6, 7, they tell me, no, she cannot start right her from P1. She has never been to school.
She doesn't know how to write.
She doesn't know how to write. What do you mean? What do you mean we take her to P1? So my parents had insisted, but the school won, so they take me to nursery. Baby class, I think, in the morning. So I reached there, and I don't know, these children were too young for me.
Because
the things they were teaching me, anyway, the children were just too young for me in baby class. So in the morning, I was in baby class. In the afternoon, they took me baby. The next is middle. I don't even know the levels. So I skipped middle. In the afternoon, I went to top
class.
When I reached top, I think the teacher was telling me to write 1, but a stick 1. But then my grandfather, I think their kind of training, it was the training from the British initially. They had taught them to write this one that has a curved down and then curved in front. You know those letters. So I told the teacher, I told her, you're lying. That's not how they write 1. I told her, let me show you. So I wrote for her that 1. And she looked at me. She kept quiet. Then I think she talks to another teacher. Then they now give me drawings. They gave me a stick boy, you know, that head, then the cross. I still told the teacher, no, this is not how they do it, because My grandfather would like draw diagrams in 3D, and he wouldn't give me like just one diagram. He would draw for you a woman carrying a baby and firewood. And that's what I was drawing at home. So now giving me a stick man and telling me that's a person. No. I told them, no, that's not how I do it. Let me show you. So I drew for them that kind of diagram, and they're like, ah, okay. They called the P1 teacher that same day in the evening as
Go to P1. So in a day, you've gone through all the stages to P1. Wow.
Yes. So I went to about 4 primary schools. Not about, there were actually 4 primary schools. Why? Is because we relocated somewhere in the middle. We relocated, so I had to move and also change school. So primary 1, I was a very talkative child. The first time we arrived, it was a new kind of environment. It was a new area. It was in Bunyoro region. We had shifted to Bunyoro region. I didn't know the language, but I didn't care. I talked to people in the language that I knew. Yeah, so the first term, I remember, I didn't even know this until like the 3rd term. So the first term I was the 79th out of 100 and something children.
Yeah.
Then the 2nd term, I became the 11th out of still 100 and something. Then the 3rd term, I topped the class. So I didn't know about all these performances because I was just a child going to school, coming back. I didn't know about these performances until like the 3rd term, when my class teacher calls me and he asks, and she gives me a coin. I think it was 100. I don't remember. And she says, oh, this girl, she was the 79th. I think because of language barrier. You know those village schools, sometimes they teach even in their own language. So but then 2nd term she did like this. 3rd term she's now the best. This is a challenge to all of you. I'm like, oh, this is the trend of, I didn't know what is performance. Okay. Now from that time onwards up to P3, I didn't look back. I was topping the class until now P3.
Wow.
What happens in P3? I changed school again. So now this school where I was in P1 is my 2nd school. So I changed school from P3. I got to another school, but I think I spent there like 2 weeks. Yeah, I wasn't there for so long. So I don't even have like very clear memories about them. 3rd term, my parents suggest that I go to another school. It was a private school, a church of the church. Yeah. So I got to this school. It had less pupils. Well, because it was private and in the village, so not very many could afford it. So I got to this school, and reaching there, because it was my first time there, but also I think kids there were more brilliant.
Okay, so you finally found a school that is going to outcompete you.
Yes, but now I was the 3rd, the first term. So what happens? I go home, I am the 3rd. My grandfather looks at my report. He's like, no, this can't be your performance. Remember from P1, I've been like,
you're topping out the class.
Yes, like for me, I'd now maintained a trend. He's like, no, they've cheated you. Okay. It's like, dress up, let's go back to school. So we go, I'm confused. I'm like, what are we going to do? What have I done? I am the 3rd. So he enters the headmaster's office. He carries all the other previous reports as the 1st. He tells him, this is the trend. My child has never been the 2nd. My child is always the 1st. You've cheated her. So 2 options. You either change the position to the 1st, or you keep the report. Me, I won't keep that report in my records. So the headmaster was confused. He looked at me. He's like, oh, what's going on? Anyway, long story short,
Yeah.
The headmaster got whitewash. He changed the report card.
To number
The
one.
report card is still there up to now. So now my father tells me, you're going to have to like put in effort so that your grandfather doesn't
Does
stress
not?
the
Yeah,
school
true.
always. But me, besides stressing the school and whatever, this was a point of like he had so much trust in me. Even as I worked through school, it was, I cannot disappoint this man.
Yeah.
Like you get that positive affirmation, and that belief in you is like very important into pushing us to like be better people. Or I can't even say he had ever beaten me or what, yet you know how children
You
are.
kept doing your thing.
But now me, I would be motivated by the fact that, oh, I can't disappoint him, I can't disappoint him, I can't disappoint him. This is what he expects, and I can't go below
So
that.
from that moment to university.
Not possible. From that moment, I think, to the end of P7, I stopped the class. It didn't matter how many aggregates I'd gotten, and not like he was forcing them again to do it. Well, somewhere in the middle, I think after senior 6, my guardian still gives me advice. My father tells me, oh, nowadays the traditional courses are not trending anymore. Why don't you try pharmacy? Well, if you want to go into the medical space. But because of, like I told you, the inspirations that I'd had from the beginning, I even refused to listen from the actual person who had given me the inspiration. I tell him, no, this is my passion, this is where I have to go. So yeah, because at that point when I was joining university, I had a choice to make pharmacy or medicine, but I still chose medicine.
Yeah. And today we have a doctor.
Yes.
Okay, so doctor, tell us more about your work. Yeah.
Okay.
How does it feel being a doctor and at a young age? You know, I know
Am I
challenges.
when patients tell me, oh, doctor, I look so young, until like 18. Like, how do you think I studied all the A level to 5 years, 6 years of medical school, and I'm still 18.
And there are some patients who would not want a young person to, you know, handle them.
Those are some of the challenges that we get in the space. But how it feels, my kind of work, yes, it feels great finally living my dream. Currently, like I said, health education, community projects, a few hospital work here and there, but my career officially started from Mulago Hospital.
Okay.
That 1 year mandatory medical internship that we do, and I completed in April this year. Yes, so that's where I had a touch. But even before that, during medical school, we go to the hospitals. The university that I went to has those placement. Instead of going to school for maybe sit in class, they have those centers in the different hospitals in the communities where you go and experience, because I might be studying in an area, but in that area there is something we call endemicity of diseases. You find that in that area that disease is not common there. So when you move around, you have a touch of, you know, the disease there. And because medicine is evidence-based learning, so you might never really get the clear picture of the disease by just reading it in a textbook. It sticks better when you see patients and treat them. You will never forget. So we had those programs where you move. I'd gone to Mubende, I'd gone to Jinja, the public hospitals. So having that touch helped me also pave through my internship, I knew how to handle the various patients. I knew the kind of, because the systems almost are the same in the public hospitals. Yeah, so it was very helpful for me that time. We have almost the same problems, improvising little equipment here and there. So yes, so I complete my internship and start working in some private hospitals around Kampala. And you find that there is a very big difference between private and the public hospitals. Yes, in the public hospitals, we are struggling with the patients in the sense of, you need this test, I don't have money, doctor. You need this medicine, we don't have it in the hospital, you have to buy it, I don't have money. Now, in the government hospitals, you're struggling with patients coming in with their own diagnosis and telling you, I want this test, and you're telling them it's not necessary. You understand? So there are challenges, but either way, you find a way to, pave around them. That's, I think, one quality that doctors should have, like how to deal with people and, yes, but that's the kind of workspace that I am in currently. Okay. Yeah.
And okay, were you already an intern, a medical intern during COVID-19?
No. During COVID-19, I was in my final year of medical school. So being in my final year of medical school, at first, it was exciting. Yeah, it was exciting. You're going to school, you're completing what? I think I was going to Ginger Regional Referral Hospital that time. So we hadn't reported, they closed. So when they closed, at first, I just stayed home. I wasn't doing anything because we thought the closure would take a short time. Yeah, remember they used to announce 21 days,
more
14
days, more days.
So they would just keep adding. I noticed this wasn't going anywhere. So that's when I started practicing. I started volunteering at a nearby health facility. But then also, because remember the first lockdown was total lockdown, no movement, no what. So I think even patients were they didn't have means of coming to the hospital. Yeah.
True.
So it was so hard for them. So what did I do? I teamed up with a group of, I think were three, there were a number of three. So teamed up with two others. We started doing community outreaches, like now us would go to the patients themselves, because us now we could move.
Yeah,
you've been able to get the travel documents from, who are getting them from? LC5? I don't remember. Yes, we are getting the travel documents from someone, and then moving into the communities. Yes, so during that time, a number of things were done. You do drug deliveries for example, those patients who have chronic illnesses, and they have to do drug refills. So instead of them coming to the hospital with no means, you take the hospitals to them. We also had cases. We had people who reported cases of delivering mothers from home. So usually by final year, you are done with everything. You're just polishing up, and so we could do all those things. So now I think that's still during the same time when we started the handwork that I told you about, crochet bill. And very many people jumped in. So by the time we were called back to school, I thought I had stabilized. I was, initially we were waiting. My God, this is so boring being at home. What do I do with my medical degree? We're all with my medical knowledge. But now I'd figured out, community outreaches, and then this other side thing that I was doing. Yeah. So that's where I was.
Okay. And then in your profession as a doctor, how innovative are you? You've talked about the sorry about my voice. You've talked about the community outreaches. Yes, that is being innovative. That is beautiful. But then these days I see doctors on TikTok, doctors on YouTube. They're sharing a lot. So how have you been able to handle? I know.
Okay.
Yeah.
So, like I had said, the doctor-patient ratio is still unfavorable in Uganda. Um, World Health Organization recommends one doctor for every population of 1,000 people. But what we have in Uganda is one doctor to 25,000 people. So about remaining relevant, every doctor will be relevant, definitely. Yeah, everyone in this career will be relevant. What you have to do is choose your niche, choose your space to be. If your space is health education, go into that. Do that. If your space is community outreaches, do that. Sitting in the hospital and taking care of patients, do that. Yeah, currently what we are doing still with another team, I love teamwork a lot. A lot is there is you've seen all these things about telemedicine by the fact that you know how nowadays everything is running through apps. Glovo, you get food on the app. Safe Border, you get food on the app. Those things. So through telemedicine, again, we've tried to marry the conventional medicine, the historical medicine, with where ICT is taking us. Yes, so a group, still the group that we started with in COVID-19, again, took on the passion, and we have something called Dynamic Doctors Digital Health Program.
Okay.
Yeah, so what we do in this case, we just have patients calling in for remote consultations. We do patient visits, home visits, physiotherapy. You get instead of you coming to the physiotherapist, we have the physiotherapists going to them, bedside nurses, and then also what else is done? And then drug refills as well from that time. Yeah, so we look forward to growing it more, having toll-free lines and all that. Yeah, but that's where we are currently in terms of innovation. Yeah.
Oh, and that is nice, because if people can, you can call a doctor. It's a call away and someone is able to
we
help.
noticed that there was a gap in the sense that, well, we have the patients not complaining about long queues and transport costs. Well, you still pay the transport for the doctor to come, but now you skip the queues. Yeah. So they are complaining about the queues, but we also have the doctors complaining about unemployment. Yes. So there was this gap that we just looked at, and we are like, okay, we can serve the population, the community, through doing it this way. Let's connect the doctors who are unemployed to the community.
So is it yielding? Is it helping?
It's helping the people a lot, and some doctors who are employed there. Yeah. The people always have you hear them telling you when you go to see them, oh, thank you, doctor, because I don't know, I don't want to overgo to the hospital because of the long queues. But then also
not
my
only the
neighbors,
long queues, sometimes you go now, like the case at Mulago, most people are complaining. You go to hospital, you spend a day there, you even come out having other.
yes. So
it helps a lot.
Someone was complaining like, hey, I'm over going to the hospital for the drug refills. My neighbors will start stigmatizing me, thinking I have some disease that I don't even have. So yeah,
True.
that's it. Sometimes we overlook these things, and then also because now when we say telemedicine, again, sometimes we are targeting a certain population, because when you develop an app, the people who have no
Yeah,
smartphones
true.
won't be able to access you. And yet, these are the people with challenges, with the most challenges, and these are also the areas where doctors don't want to go to. We have we have an even distribution in Uganda, unless a doctor is like, sometimes those doctors who are passionate about community service just carry their staff after graduation and go to the villages. That's one option. The other one, those ones who are deployed there by the government, they go. Then those ones who are deployed by the NGOs, they also go. But we have a lot of clustering of us in the urban areas,
true.
and then we ignore the people in the remote areas. So our kind of digital health program is basic in a way that it's just a phone call. It's just a phone call. So whether you have a smartphone or not a smartphone, you can always give us a phone call.
Okay.
Yeah.
So people who do not know about this, how do they get to know that you're doing this digital health?
How do they get to
Or
know?
you have people referring them, try this number. I think it should be out. Maybe you should do it so that many people can get to know about.
Okay, yes.
Yeah.
Currently, what we've been doing, because the team is spread out to different areas. So basically, what we've been doing is just the referrals, but then also the patients you meet in the hospitals, when they need the drug refills, you can offer to take them take them there.
Yeah. And doctor, you for the time that you've practiced medicine, what is the most challenging moment? One that you felt like, oh my God, this is too big for me.
Yes, we have those moments that you look up and you're like,
You can't take this.
why did I study this? What was I thinking?
So has that moment ever come and you?
Yes, it has. It has. It's very painful to look at someone dying when you know what you could have done for them, but they're going to die because there are no equipment. They don't have the money, but they don't even have the caretaker. So my very devastating moments were at the casualty of Mulago. Would have the casualty patients coming in. These are accident patients, or people who have been beaten up on the road, or people who are drunk, falling on the road and being brought in by police. They have no caretakers, they have no one. But usually when they come in, when a patient comes in and they have a caretaker, you tell the caretaker, oh, now we need this, and this, because the hospital doesn't have it. When it has it, well, you just go ahead and work. But in most cases, like I'd say, the challenges that we have in the health sector, in most cases, we don't have the things. So we have to send these people outside. So now, in this case, you're looking for who to send, and you can't find, and you have like 35 dying patients at once on the floor. So in that case, looking at a patient and knowing in the next 30 minutes, if I don't cover up or tie this bleeding wound, they're going to die. And they actually die. That's very painful. That's traumatizing for humanity.
And how do you even go over that? Because I know it happens on a daily and...
It does. Now this has even created, what do they say? People say doctors don't care. Healthcare's healthcare's don't care. They act like they're not humans. Now those are the effects of such things that happen to us. Yeah. So way back when I was in like third year, we started going to the ward in third year. They would distribute beds. This bed, this patient is for you, Prima. This patient is for Madreen, like that. So when I would have a bed, and that's my patient, and the patient dies, I wouldn't come to the ward for 2 days. I wouldn't come to the ward. And oh, they're looking for you. Oh, where is Prima? She's not here. Why? She lost a patient. So my professors, my teachers sat me down and talked sense into me. They told me you're going to have a line of 20 patients. So when one patient dies, you're going to leave the rest to die because one patient has died. Like, we understand, even as we are humans, but now you have to focus on how many lives around you that you can save. So it has a negative impact on our emotions at the end of the day. But we try to remain as human as possible.
This is one of the most difficult callings.
It is.
I know.
Yeah.
So emotional. Yeah. And one of the things that, one of the achievements, the biggest achievement, you've handled a patient and you feel, yeah, you've done it. The patient has appreciated. Have you had such moments?
Yes, I have. And you see, they're not really like, they're not always the the most complicated, maybe things that you'd think about. They are very small things that you do for patients, and you know, in their hearts, in their actions, they're like, what? Yes. So usually my practice, my practical ethics are centered around patient-centered care and kindness and empathy. By patient-centered care, I wouldn't say it's a new concept. It's what is actually supposed to be done. But I think for a long time in Uganda, for some reason, especially in the public hospitals, we haven't been doing it. You know, a patient comes in, you take off blood, you don't tell the patient what you're going to do. Like, patients just keep seeing things happening. Their relatives call.
Also, your handwritings, we do not understand. Those symbols that you put on the things we don't understand.
Sorry about that. So now that concept is to like explain to the patient what's going on. Not just that, treat patients holistically. Before you prescribe drugs of 500K, find out if they actually have where to sleep. Find out if they have food to eat at home. You understand? So we come and focus on disease, and sometimes what kills the patient is not the disease.
Something else.
It's the emotions, it's maybe the people at home. It's something, it's as simple as just talking to the patient and explaining to them.
So when you're doing the training, is that included? Do they teach you that? Because I see it's really important.
Yes, I am coming. I'm coming there. So they teach you that? I think they do. They teach us. Not I think. They actually teach us. But now what happens is that now when you come into the practice,
the reality is different.
Yes, like you find that the lines are too long. Those are the reasons I've gotten for us who don't practice it. Even me on the days when I don't do it. So the lines are so long, and then you want to clear them. So you're like, the patient will figure out, or the nurse will explain. But then also the nurse is thinking the doctor has explained. The lab person, by the time you send to the lab, they are thinking the doctor or the nurse has explained. So we are delegating our duty to, but not communicating effectively. So they do teach us, but we lose track somewhere there. So again, what my colleagues and I have done is we've started, because NIGHT has been running for 3 years. We started it when we were medical students. And it's called Patient-Centered Care Movement Africa. It's a student-led organization. And what we basically do is advocate for patient-centered care, but then also, because it operates through university chapters, we want to start from the baseline, from where the doctors are produced, not after the doctors have come up, and then you're telling them you have to do this, this, and this. We want to start from there. So it's currently running in 11 African countries, because we noticed it's an African thing.
Yeah.
Outside in Europe, people are, how don't you explain to those people what you're doing to them? How do you just take off their blood sample and not tell them why you're taking it? So we noticed it was an African thing.
Like, here, go and read your things.
Go and do this. We decided to do it in the entire Africa. So with some support, of course, we have a few support from Makerere University, State Global Health, Infectious Diseases Institute. We decided to start up that, and we operate through university chapters, which are universities. So we do trainings for patient-centered care. We do boot camps still around that. Yes, we do conferences. We had our first conference recently here in Kampala. Yeah, we look forward to more conferences and to growing more. We're in our third year. Yes, and yeah, so that's what we are doing. So still, you asked about my biggest, not biggest achievement, like a moment when a patient. So it was, I think, malaria in a child. Yes. And this mother and father had come like the previous day to acute, that is the emergency unit of pediatrics. So they reach there, and as usual, take off samples, blood samples, give medicine. The parents are seeing things running through the baby's veins. They don't understand what's going on. No one has talked to them. So usually that is like our triage area where they reach, and we separate. This is a case that belongs here, and then here, and then here. So me, that time I was on ward. So the next day after this is a heart condition, so go to the heart ward. This is malaria, so go here. So it was actually diarrhea. I remember, because I was on a diarrhea ward. So the next day now is when they come in. So I talk to them, I ask them, those questions that we ask you: when did it start? How did it start? Do you have fever? Yes, so I ask them those things, and then after I explain to them what's going on. I tell the father, oh, this and this is going on, and this is the medication that we are going to give, and we hope that by 2 or 3 days you'll be going home. And when you go home, do this and this so that this doesn't occur again. Father looked at me, it's like, we've been here for this time. No one had told me what's going on. I just saw things running through my child's veins. I didn't know what was going on. Thank you so much, doctor. And God bless you. And I would like to give you this amount of money. But it's free service in Mulango. And they're going to, in the long run, buy other things, drugs. So you don't even want, and it's a struggling family. You don't want to take away their small money that they have. So I told him, thank you so much. Thank you for appreciating, but please keep the money for like other needs that you need. But he insisted. He was like very, very grateful. He was like, yeah, I know, doctor, it's very little, but grateful heart. So like I said, it's very small things that actually tip off these patients. Yes. Even in medical school, they actually don't grade our degrees.
And I'm surprised you had to reject the money. Yet we've seen a lot of cases where doctors are being bribed.
It's very sad. It is sad.
It is very sad.
It's sad.
And some have filed cases about. Recently, I saw one in Naguru whereby a minister pretended to be, a patient.
I saw that,
and a doctor was,
Yeah. When they give it to you that way of, oh, thank you, doctor. It's okay to take it.
I think it is different.
It's okay. Yeah. But now, in cases where we have to pester the patients, if you don't bring this amount of money, I am not going to treat you.
And then I think it goes back to
in a public
welfare
hospital.
government.
It does, but you find that this person who is going to die or whatever is going to happen to them, they even have nothing to do with what's going on. Like, it's a battle between well, the community is involved because at the end of the day, they are the taxpayers and everything. But I feel like we are downloading our anger and our dissatisfaction to the wrong people. Yeah. So.
And in Uganda, I think it's common everywhere, in all hospitals. I don't know. Before you even deposit, they cannot touch your patient. Before you have put something, you know. I think you're trying to save someone. But then how do you think of money?
Now, it also depends on whether the hospital is private or public.
So
now, I speak that in a public point of view, but even private practice, they have a policy where if it's a consultation and not an emergency case, the ideal is to you deposit. I mean, it's not an emergency. You came from home knowing that I'm going to this hospital that charges this amount of money to do what? To see the patient. But they also have a policy where if it's an emergency, they'll work on the patient and then you pay in the meantime. So those are straight up ideal things that are being done. But we understand things are being done behind the corners, and that's very unfortunate. And we apologize on behalf of all our colleagues who are doing it.
Yeah. And then also about money still. There is a case I saw. I think these parents went into to have their baby, and the hospital, I don't know, they operated the lady, they had the baby, but the hospital refused to give them the baby. Before clearing a bill, was it 4 million, something like that? And they kept the baby for a month. They went to court. I mean, how can you be away? How can a mother be away from the baby? And then it is also maybe a mistake for the parents. Why would you go to a hospital you cannot afford?
I saw the case on TV as well, but it's still as abstract as you say, because it's still in court. We do not know who is saying the right thing or is saying the wrong thing, but it's I wouldn't want to take a side. I wouldn't want to take a side really until the case is done.
True.
Yeah.
Because it's you can't be on the parent side. I mean, we can't take sides on that. So doctor, away from your medical field, you're doing something. You have a company you started with your friends, Crocheting. Please take us more. Tell us more about that.
The Crocheting, it's been now 4 years of operation, I think. Yes, so we get yarn, threads, and we make those various items that I told you: sweaters, shoes, baby clothes, and very many things out of them. And we sell them and make money, because now you see at the end of the day why we as doctors are doing all that. Oh, give me money or else I won't work on you. At the end of the day, this profession,
you also need money.
Yes, you need money. And this profession, because when they said doctor, even if you're at a wedding meeting and they said doctor,
everyone thinks you have money.
Exactly. So if you focus on getting money from your patients or from the sector, like getting rich, you might blunder somewhere. So that's why we begin these skilling projects to use our talents elsewhere and see if we can earn elsewhere and be good doctors. Better doctors who have money from elsewhere are very good doctors. They come to the hospital and they're happy. The things that are stressing us are, I don't have pure money.
They'll even be able to explain to us.
You understand? They're not on any rush for anything. So basically, we started that on that basis, but then also because we had the passion for it and then the skills as well. Yes.
So it is the same, like it's skilling the mothers, the ones.
It's through that same project. That same project that now we decided to extend a skilling program. Still, the skilling is about what we were doing, basically us. How can we extend these services now to the mothers, to our patients who are on the ward, so that they also earn from it. Yes, and be able to support their children, because in most cases you would you receive patients and you're asking the mother, why did you take long to bring the child? When the child is in, I can't say reversible state, but if they had come earlier, you would have been in position to help better. And then they tell you, oh, the father told me he didn't have the money, but then also he insisted on me going to this cheap place, to this cheap place. He told me I can't go anywhere else. And then you see if I can't go anywhere else if I'm not the one paying the money. So you see, if these mothers had like their own capacity of getting the money, they would have come earlier. You get, yeah. So we started the skilling program on that basis. Yeah.
So how has it been? How is it growing?
Again, I am going to say that inception stage, is it called inception, where you have like just 3 enrolled and then they come in and then jump out at one point. When their children were discharged from the ward, they got out. So we had,
so you don't follow up.
we do follow up, but now they will tell you, oh, I went into other things. Or sometimes when they are earning from it, they just they just stop updating you. You just lose contact. They continue making their money and not giving you the updates on how it's doing. You want to do home visits, but they're telling you, doctor, I'm in Kayunga.
That is really bad.
I'm in Kayunga, but the few mothers that we've been able to follow up with, they are still doing well. Yeah, they are doing well. A few challenges here and there. But not really bad.
So where do people find Crochetville?
Avema in town. Yes, we also make graduation sessions, like I had said.
And graduation is coming.
Graduation is coming. So Avema on Lomu Street in Kampala. Yes, that's where we are located.
Okay, so that takes part of your time.
Yeah, partly. But I'm not on the. I used to be on the technical team when I had the time in COVID-19, but now I'm just up there. Receive orders, send them down to the technical people, and then deliveries and feedback. Yeah.
Okay. So as a doctor, what are some of your work ethics? What do you look at and say, this is what has kept me moving in this profession?
Okay. So like I'd said, patient-centered careness and empathy and kindness. You want to put yourself in the patient's shoes and imagine if it was you. But that helps you to, deliver better. If it's an elderly man, you want to imagine if this was my father, how would I have treated him? But then also for a very long time, medicine was paternalistic, I think, whereby if a doctor says this is how it's supposed to be. There is no argument, no debate, no nothing. But I prefer to do it in a more interactive way. I prefer to give my patients options. Okay, of course, after explaining to them what's going on, now give them options and then have them choose. Tell me, oh, this is what works for me. This is better for me than this one because of such and such reasons. And then I guide accordingly. Okay. So that's part of my work ethics. Yes.
Okay, and as we come to the conclusion of this, to the young girls who want to join your profession, first of all, isn't it expensive as a profession? Because our parents, out there might not be able. You want your daughter to do medicine, that's finances. And then also to the young girls, please talk to the young women, encourage them. Yes.
Okay. Yes, it's expensive in private universities. But if you're out there and you are in your probably senior 4, senior 5, work towards government sponsorship. There are sponsorships in the public universities where you can get. Then if you miss it, you can go to a private university. It will be a little expensive, but at the end of the day, it's rewarding. It's rewarding emotionally and financially if you choose to. So I just encourage you to be limitless. Don't let anyone tell you, oh, you're too ambitious, you can't achieve that. Me, I've applied to Harvard before. Like immediately after my bachelor's, I was applying for a master's at Harvard, and people are telling me, that's being too ambitious. Stop. There are things that society tells us as girls that dim us to some level. So to a young girl out there, I don't want you to think about that. So many times we used to see so many male doctors, and there were very few female doctors. But nowadays people have broken barriers, and we are seeing the female doctors. I met a female doctor when I think I was in P1. Yes, so we've broken the barriers. Yeah. Please come. We shall be here to guide you through the journey, and just stay focused, pray to God, live a day at a time. The sky is not even the limit. Yeah.
Sure. And Dr. Prima is not only doing her profession, but she's also venturing into something else, what she feels her passion. She's doing something with Crocheting, supporting mothers, the outpatients. So it's a lot that she's doing that we really need to appreciate her for. And Doctor, in your last remarks, please tell our viewers what you think you don't want to be left out.
Okay. I want to tell our viewers in general, that means in general, that please seek for the right health information. We've said there is a lot of information right now going on. There is so much on Google, but what I tell my patients is to look for trusted sources.
And most of us really treat ourselves from Google.
Yes.
I think you might even find getting
that's a
gives
problem.
You
it's a problem.
The moment you feel something, let me Google about this.
You Google and then you go and do self-prescribing, buy over-the-counter drugs, and then by the time you come to us, it's too late. We are in terminal stage. So that's the challenge that we are facing currently. And do those routine medical checkups. Don't wait for when you're feeling unhealthy, when you have a fever, when you're shivering, to start going to the hospital. No, make it routine. You can do every 4 months or every 6 months. Just go and do a checkup and find out what's going on. Yes, that's very, very key. And we are very proud of you and the health sector. We are very happy to serve you, the Ugandans. Yes.
Well, you've heard it from Dr. Prima. Yes, she has her story. She's still doing a lot. She's a young doctor. She still has a lot to do, for our society, and we continue to pray for her that whatever she is planning to do with her teammates, that it is blessed and it will benefit our society as at large. Thank you for always tuning into Civic Space TV. You have been really wonderful viewers. Kindly share our link to all your family, friends to always watch. Also, our previous episodes, you can always catch them and enjoy. I've been your host. Thank you to all our team that supports this particular show. Till we meet again, see you. Bye.